Hi, everyone. It's Rob from Point2Point Podcast.
Good evening, everyone. This is Tony. So, Rob, what are we going to do tonight? What are we going to talk about?
I want to talk a little bit more about the treatment modalities because we
Hmm.
were talking about cupping the last time. And I kind of made I don't say a small mistake, but we were talking about how long to keep the cups on the body. And I actually checked one of the CEUs that I talked about.
Uh,
They said it should be 5 to 10 minutes.
nah,
Yeah, 5 to 10 minutes. Well, I double
no.
checked. I did double check. I did double check again, and they said the maximum is 10 to 15 minutes. And I said, okay, that makes sense. But if it's moving cupping, you really can't do that because you're not keeping it stationary. So you can move it up and down for 10 to 15 minutes, but just to leave the cups on there, there's like don't leave it any more than 15 minutes, which is fine.
No, that's what it is. 15 minutes max. But one the CU said 5 to 10 minutes
Yeah,
for
the CEU actually said 5 to 10 minutes.
that's mostly real updates information.
Well, I put little blurbs down at the bottom with that too. I said the
No,
recommended amount is 5 to 10, but the maximum is 10 to 15.
I think there's a lot, probably there's a lot of problems with
There's people
cupping.
who do more.
Most of them they do cupping. They're not acupuncturist, professional writer.
There's that too.
Anybody can do cuppings.
Yeah. I was very interested in some of the newer cups that you were talking about though, like the one with the heating and the
Oh
other one
yeah,
with the
the
electrical
electric
stun.
one where we can charge. I think use the USB-C. You just charge it, then it's portable. Press the button, it sucks it up. Instead using five cupping, which is much is safer. A lot of people nowadays they like the plastic cupping.
Yeah.
This machine is a plastic and it creates their own suctions. It's like a vacuum, its own. Then it can give you a infrared lamp. There's so many different types. Another one they could include electric stim. There's a rim they attach the electric stimulation on it. You suck it up, or you could add heat to it too. It's crazy. There's so many things, especially in China now. They're really advanced with technology, especially when it's come with Asian medicines equipment. Here we haven't seen it yet, but you can really Google it too. And I think some of things selling Amazon maybe $20 to $30 now. But heck, the thing is, I did not buy it at that time. It cost $40 or something. Like, like that's just too much for one cup.
Yeah.
Yeah, it's good for moving cupping too. So for our traditional moving cupping, either glass or plastic, something when we move, the suction will be the rims, the seal will be gone. But I do like when this machines it create a vacuum on its own. So when you move it around, it's doing gua sha at the same time. It's just more efficient for me.
Mm.
When you could add the healing elements to it at the same time, you could do three treatments altogether: gua sha, cupping, and infrared lamp, which I like. I definitely going to try it once I go to China. To buy in China instead of like paying the shipping fee. Yeah, I could smoke a couple of them.
As also what we were talking about there was the infrared heat because we used it a lot at the student clinic, but I really liked using it in my clinic too. It was very useful for someone with back pain, only
Hmm.
because heat makes things. It would help relax the muscle, and I combine it with the cupping as well. So to have it actually within the cup is nice too.
So you use plastic or glass for that? What were you thinking?
So I had both. It really depends what I felt would be useful. For the back, I used glass.
Hmm.
If I did it on the legs, I actually used the plastic.
I would keep plastic too because it's easier to
Yeah, it makes it they're smaller.
Mhm.
But the glass itself works the glass one and the size of it works much, much better for the back because of the surface area, basically. So what I would do is I would have the heat lamp going down on the back. I would have the oil. I would do the fire cupping to put it on.
Mhm.
Then I could go up and down with the cup.
Moving.
So again, it's all three things. So the new type of cup, that's why I was interested in it. The new type of cup kind of takes care of all
Mhm,
three
mhm.
things at once.
Yeah.
The other nice thing is people just like the heat anyway. So you can buy just the infrared lamp on Amazon. If you feel like your feet are cold or your hands are cold or your back is cold, you can just put it on and leave it on your back for 15 minutes. And again, does wonders just for yourself. And it's a simple thing that doesn't really need a lot of attention to.
Mhm,
You
mhm.
know, cupping, you need to understand some of the nuances and some of the problems that can happen with it.
A lot of people they think cupping says, okay, let me make the suction. Okay, done. But a lot of people don't realize there's a colors on your
Yeah,
skin to tell like what's the issue to the patients. I think we mentioned that in the previous podcast.
yeah. And I also said you should look on TikTok because there's a lot of people who played with the cupping on their face and they end up having a huge purple bruise on their forehead and their cheeks because they didn't know what would really happen if they left the cups on too long. And even
Even for more than a minute, you will have marks.
yeah,
That's why we do flash cupping for the
yes,
facial part. You not meant to leave it on,
no,
and that's how actually promote more the circulations better, move the movements. But maybe not your muscle related, but people who have pains, they don't realize how tight their back are. When I treat them, I'm like, wow, your back is a rock. Even myself, my upper
yeah,
back is a rock. I have problems inserting needle with that.
oh yeah,
So definitely we do cupping first or acupressure. People say massage or whatever. Loosen up the muscle first. Put that lamp first or heating pads. Uh, Once the muscle relaxes, it helps us it increase our therapeutic treatments a lot more. I like to combine with different treatments. Acupuncture by itself to me is that's good, but a lot of patients doesn't like that. Why? Because they didn't feel that you're doing anything. You just put needles there.
yeah,
They want say when they pay, they want some actions. When we do cupping, I love cuppings, especially when our muscles tight. Uh, You feel that release right away. Comparing to well, contrast with the acupuncture needles. For me, I don't feel the release with my tightness with the acupuncture needles. Maybe I need more time, but 30 minutes it doesn't cut it for me.
hmm,
But when I use cupping for 10 to 15 minutes, once that cupping release, you can feel, wow, you feel, I like that. That's how I felt. I'm not sure how other people feel. Because once your muscles like this tight, then when you release, you can feel the blood sometimes rush around the area. The muscle start to relax.
so I want to touch on that a little bit more, but what I'm going to do now is I want to talk a little about our tools of the trade, so to speak. Acupuncture and acupuncture needles are only part of the tools that we use to treat
Mhm,
problems. We can't use acupuncture for everything,
mhm,
and that's what people believe is that we just use, you have a headache, acupuncture, you have foot pain, acupuncture, you have back pain, acupuncture, constipation, use acupuncture, diarrhea, use acupuncture. No, there's a lot more that goes with it. There's a lot better treatments that can go along with it too. It depends on the root cause. So, with that said,
mhm,
for everyone out there, if you're going to an acupuncturist, that only does acupuncture for you, you need to look into maybe finding a different practitioner. Because let's say, for example, you have back pain, using the cups, using the TDP, the infrared heat lamp, using acupuncture is going to have a much greater effect than just using the needles alone. Adding massage to it, anything muscle related. If the muscles are tight, and you said it too, it's hard to get the needle inside a very tight muscle. Absolutely correct. You put the TDP lamp on it for 15 minutes, give it twina or massage. Now all of a sudden the muscle, his whole body's going to be more relaxed. Now the needle's going to go in very nicely. Sometimes it's not how long you keep the needle in as it is opposed to making sure the needle has the greatest effect. Because if you put the needle into a very tight muscle, it will loosen up, but it'll only loosen up a little bit.
Mhm.
You know, the longer you leave it in, the longer your body's going to go, you know, you've had this needle in for quite a bit now. This really shouldn't be here. And right at that point, it's not going to do anything else. Going into some more of the mysticism part of it, like my martial arts friends like, the idea of using the acupuncture needle is only to regulate the flow of, I'm going to say the flow of chi, but if something is disrupted, the needle can be used to put it back into balance. And sometimes there are little problems where just the needles will work wonders. But many of the problems that a lot of us have, no matter where you are, the main cause is from stress, trauma, getting hurt. Anything with stress is going to make your muscles tight. Anything with trauma is going to make the muscles bruised. And this is where the extra modalities really come into their own. It's very rare that you would see a problem that just uses the needle itself. And for the life of me, I can't pull one out of my head at the moment.
Even the, if we do insurance billing,
Mhm.
by putting the needles on the patients and doing nothing, you cannot be billed for the timing. One-on-one patient contact is that you still have to get involved. So that's why we do acupressure, cuppings, moving cupping, not station cupping. That this way we can bill justifies the treatment. If the insurance company do tells like, what the heck you guys doing? You really? Yeah, this is how I document. We perform moving cupping. But if you do perform moving cupping, you have to state like where do you put the cupping. On the back, you have to say I'm doing moving cupping from maybe bladder channels or wherever. You have to document that. They say because insurance nowadays they will look into it, especially if you get audited, they would look through all your notes. Beginning, they might not care so much, but as time go by, if you have more and more patients and they pay you a lot more than they expect to pay you, then they will audit.
Well, that's another problem too, is a great many of the modalities that we have, the insurance companies won't cover.
Mhm.
There are treatment codes for using cupping. There are treatment codes for using the TDP lamp. There are there's definitely treatment codes for massage and
It's hard because
yeah.
our profession really, our acupuncturist group is we're in a gray area.
I just want to throw one thing out because I know there are certain people who will go, well, you're not a massage therapist, so you shouldn't be billing for that anyway. The thing is dependent on your scope of treatment based on what the state allows. Since we're in New York, the state does allow acupuncturists to do massage.
Because we learn tree knots and manual therapy, all those things.
Yes.
But they just say massage code, but that don't mean massage is only for massage therapists. PT uses it, chiropractic uses.
Yeah.
medical doctor, and even these like infrared lamp. See, sometimes the insurance will say infrared lamps belong to physical therapists. No, any health providers can use them, but they just being a pain because they don't know who you are, which category you fall under. Because acupuncturists till nowadays still are problematic because they did not group us because they don't recognize us that well.
That also includes the E&M codes, the evaluation and management. The insurance companies don't recognize us as being a practitioner that can evaluate a medical problem on a person. All we supposed to know is that this person has back pain. We put the needles on the back pain. We fill out the form that we did the needles for 15 minutes and maybe another 15 minutes if there's another issue, and then that's the end of it. That isn't the extent of what we were taught. Again, it's just what they understand, not what they know. We're just not recognized.
Why we're doing this podcast is to bring awareness for us. We want to educate people and share our knowledge to have more better understanding. Definitely using acupuncture along with different treatments, cupping, infrared, acupressure, massage, whatever you call it, it does help increase the therapeutic a lot more.
Mm-hmm.
In my clinic today, I treat a patient who has sciatic pain. So she get acupressure first treatments. I believe acupressure is much safer first before the acupuncture. I believe that once your muscle tight, you have to release it first. Then you insert the needle. It feels much better, much better because patient is relaxed already. Especially if first time the patient had the feel of your treatment. I don't know what the hell is acupuncture. Then if you do the acupressure or massage or whatever you call it, it helps the patient relax, help the patient calm down because skin to skin contact will give you this nice feeling. Actually, there is techniques that make them very relaxed and they doze off. It's just like in pre-hospital care.
See, I know we talked about this once before, and
Yeah.
I said I want to stay away from like large intestine 4, liver 3. But even in student clinic, I remember that those were kind of the go-to points anytime we ran into anyone with stress. That they're like, we can't sleep, we have too much on our mind. They would immediately we call it the 4 gates. We would immediately go to large intestine 4, liver 3, and in tongue. We would add in tongue. So it's like we call it we as in my clinic, we called it the star. Because
you guys call it the start. So
we called it the star because it's like a star. One here, 2 on the hands, and 2 on the feet. And it did have very, very good results. I mean, there was one gentleman who actually he fell asleep. He was comfortable. We left him and checked on him after the 15 minutes. He was still asleep. We knew he had problems sleeping, so we let him rest. He was able to wake up on his own after about 25 minutes. And when he woke up, he told us that he felt the most refreshed that he's been in years.
Wow.
Oh, please excuse me. That was the other thing. We removed the needles after 15 minutes because we didn't want to, just in case he moved around, we didn't want to leave it in there. That's something I should at least mention. Once again, making the decision whether or not you want to use large intestine 4 or liver 3 for the first treatment is up to the practitioner. It's up to the person.
Because this will be your practice. If it's someone else patient, yeah, okay. But if you are working on someone under someone else,
that's different.
If you're forcing, okay, my patient's all gone now, guess what? You get fired. Teaching clinic is different because they know it's a teaching clinic. They come in and we are students. Of course, our professor will say, no, do everything. That's how you learn.
Yeah.
But these things that we mentioned is based on our experience that LI4 really does make a strong sensation that make a lot of patients feel uncomfortable, especially they don't know what is acupuncture. If it's sensitive as needles, you could use different technique like a tapping technique just to make the people's minds away from the area. People press the guy too very hard, so it's only the two. I have a patient who's very sensitive. They say, "Oh my God, I said, no, this is plastic too. I just pressing you with the two. Look, oh okay." And bam. Once you put the needle in, you have to do quick.
Yeah.
You do slow, like some acupuncture lady, they push. I'm like, oh God, when I get treatments, I doesn't like that. You can
Ow.
do if they push
Yeah.
that quick, like mm, mm, mm. It's very some sensations. This is, I'm chicken with pain too, especially with needle pain. Just punching, kicking, bruising is okay, but needle is different sensation. So, what's your any experience with your that 5-star thing? Any other patients that feel very relaxing, or any him who have a lot of stress? I believe.
Once again, I think a good majority with stress,
Mhm.
those points worked very well, but not for everyone.
I was going to ask you, do you ever use Buddha triangle, like in the wrist area 6? Maybe.
Buddha try I have never heard that before, and I'm gonna look that up.
No, I think all other professor they come up with these names.
Yeah, I see that. Buddhist triangle for acupuncture, stress, and anxiety.
This couple types. One there I
Heart 7, pericardium 6, and lung 9.
oh see, I'm sorry, I got that wrong.
I hate to say it, that's the first time I've ever seen that.
There are also a lot of bullet triangles and I think abdomen or on the legs area. I have used that for a while, so I don't remember.
So, with my own training, I have
Mhm.
to edit this a little bit because this is going to be this is an interesting topic. With my own training, I've been told never to needle the heart channel.
Mm, I remember you mentioned it. The heart is the emperor. You don't
Yes, the
want.
heart is the emperor. You never touch the emperor. You always go around. So you use the pericardium channel. There's only one time that I've ever used the heart channel, and that's specifically used for a certain type of wrist pain. And it's interesting because I actually ran into a patient with that type of wrist pain, and I did do the point, just that point, but she didn't have the pain after that. And that was, believe it or not, it only took 2 treatments. Like I said, that's the first time I've ever heard of Buddhist triangle. We've never, and I'll read up on the document that I just pulled up on Google. We got 2 minutes left, so we're going to say goodbye.
Yeah. We talked too much again. It was supposed to be 15 minutes.
Yeah, we just
Yeah,
start
okay,
talking, and then
it's
it's
more
just
important.
here we go, which is not bad too.
Yeah.
So, all right, thanks everyone for watching, and we'll be back next week with a new episode.
Thank you. Good night, everyone.
Good night, everyone.